Hi everyone, my name is Amaya Smalls-Daly. I'm a fourth year pharmacy student at UNC, currently on rotation at the Cone Health Family Medicine Center. Today I will be going over the latest pharmacy news for the months of May and June. We will discuss updates to the 2023 Beers criteria and GINA report, bring to your attention Breyna, a branded generic for Symbicort, and discuss the FDA approvals of INPEFA and Ledoco. The first update we will discuss is the 2023 updated AGS Beers criteria. The Beers criteria purpose is to shed light on potentially inappropriate medications for use in adults 65 years old and older. It is intended to be applied in all ambulatory, acute, and institutionalized settings of care, except hospice and end-of-life care settings. Before this update, it was last updated in 2019. Important things to note, they removed 34 medications from the list that had very low or absent usage in the United States, and that can be seen on Table 8. Additionally, rivaroxaban was moved from use with caution to avoid. Warfarin was added as a medication to avoid unless DOACs are contraindicated or barriers exist, an example being cost. And apixaban was removed from the renal dosing table. There has been more evidence to suggest it is safe for use in end-stage renal disease. Aspirin for primary prevention has been moved to avoid, and if a patient is already taking aspirin, consider deprescribing. In adults 75 years and older, ticagrelor has been added to use with caution. For some other revisions, oral and transdermal estrogen is suggested to be avoided in older women or considered deprescribing. All sulfonylureas are now suggested to be avoided, and SGLT2 inhibitors should be used with caution and closer monitoring. In summary, the 2023 Beers criteria recommendations should be utilized to help optimize medication safety for our geriatric patients. The next update we will discuss is the updated 2023 GINA report. This report is updated annually and is the primary guideline for asthma management. There really are not many differences from last year's guideline, except for an addition of an as-needed ICS-SABA to the treatment algorithm for adults and adolescents. ICS formoterol still remains the preferred as-needed therapy, however. There are no studies comparing the two head-to-head, but the preference is based on the magnitude of evidence of superiority in the ICS formoterol over albuterol alone. There is limited evidence of ICS-SABA efficacy overall, but the Mandala study showed that budesonide albuterol, Airsupra, which was approved in January of this year, showed reduced risk of severe exacerbations compared with albuterol relievers alone. This is an example from the guidelines showing how as-needed ICS-SABA has been added to Track 2. For relievers in general, it's important to remember that the only ICS-LABA is ICS formoterol. All the other LABAs need albuterol for reliever therapy. This is another example of how the ICS-SABA is being integrated into the treatment algorithm. It's basically an alternative to an as-needed SABA alone for reliever therapy. Just to bring to your attention, the first FDA-approved generic version of Symbicort is available. It's called Breyna and comes in 160 by 4.5 micrograms and 80 by 4.5 micrograms, indicated for asthma and maintenance and COPD. In summary, we should utilize the 2023 GINA report to optimize care for patients with asthma. Next, we are going to discuss the FDA new drug approval of INPEFA, sotagliflozin. Sotagliflozin is a sodium glucose cotransporter type 2 SGLT2 inhibitor that also inhibits SGLT1. Inhibiting SGLT2 reduces renal reabsorption of glucose and sodium, while inhibiting SGLT1 reduces intestinal absorption of glucose and sodium. Sotagliflozin was approved by the FDA May 26th for adults with heart failure, type 2 diabetes, CKD, and other cardiovascular risk factors to reduce the risk of cardiovascular death, hospitalization for heart failure, and urgent heart failure visits. For dosing, correct volume status before starting at 200 milligrams daily and titrate to 400 milligrams as tolerated. Also, hold for at least 3 days if possible prior to any major surgery or procedure associated with prolonged fasting. Evidence for sotagliflozin was based on the SOLOIST WHF and the SCORED trials. Sotagliflozin is contraindicated in patients who have had a hypersensitivity reaction to the medication. There are a few warnings for this medication as well, including DKA in patients with type 1 diabetes, volume depletion, hypoglycemia with insulin, Fournier's gangrene, and genital mycotic infections. In summary, in PEFA, sotagliflozin is the first dual SGLT1/SGLT2 inhibitor and has a labeled indication for heart failure across the left ventricular ejection fraction spectrum, similar to Jardiance and Farxiga. Finally, we are going to discuss the FDA approval of Lidoco colchicine. For mechanism of action, colchicine inhibits beta-tubulin polymerization into microtubules, which disrupts cytoskeletal functions. These include inhibiting neutrophil functions, interfering with neutrophil platelet aggregation, and most notably inhibiting the inflammasome. Basically, it has an anti-inflammatory effect. For adverse effects, colchicine can cause some GI symptoms like nausea, vomiting, and diarrhea, and it can cause some myalgias as well. Colchicine also undergoes both hepatic and renal metabolism. Lidoco was approved by the FDA June 20th to reduce the risk of myocardial infarction, stroke, coronary revascularization, and cardiovascular death in patients with established ASCVD or multiple risk factors for cardiovascular disease. Interestingly, the dose for this tablet is 0.5 milligrams, contrary to the 0.6 milligram tablets currently on the market today. Evidence for Lidoco in cardiovascular disease is seen in the Lidoco 2 trial, where there was a 31% reduction in a composite endpoint of cardiovascular events compared to placebo in patients with chronic coronary artery disease. Colchicine is contraindicated when there is concurrent use of strong CYP3A4 or PGP inhibitors, examples being grapefruit juice and clarithromycin. Additionally, it is contraindicated in those with pre-existing blood dyscrasias, like myelosuppression, leukopenia, thrombocytopenia, also in renal failure and severe hepatic impairment. Those blood dyscrasias can also occur while taking colchicine, as well as the development of neuromuscular toxicities, including rhabdo. In summary, Lidoco is the first FDA-approved anti-inflammatory drug for cardiovascular disease. It is expected to be available during the second half of 2023. This is an overview of everything we have discussed for May and June updates. Special thanks to Dr. Peter Koval and Dr. Madison Yates for contributions to this month's updates.